Hello, this is Dr. Biff Palmer, Professor of Internal Medicine at UT Southwestern Medical Center, Dallas, Texas. I'm going to discuss the publication entitled Effect of Tenapanor on Serum Phosphate in Patients Receiving Hemodialysis by Jeffrey Block and colleagues. This study report was published in the Journal of the American Society of Nephrology. I selected this article to discuss because hyperphosphatemia is common among patients with chronic kidney disease stage 5D and is associated with morbidity and mortality. To address this problem, guidelines recommend lowering serum phosphate levels. Tenapanor is a minimally absorbed small molecule inhibitor of the sodium hydrogen exchanger isoform 3 that functions in the gut to reduce sodium and phosphate absorption. This trial assessed the effects of tenapanor on serum phosphate concentration in patients with hyperphosphatemia receiving hemodialysis. Results from the study show that tenapanor may reduce serum phosphate concentration effectively while having no direct effect on the sodium phosphate cotransporter type 2B. In addition, tenapanor may provide an option to improve adherence, addressing the reduction of pill burden more commonly associated with phosphate binders. So let's discuss the methods. This was a randomized, double-blind, placebo-controlled, fixed-dose, multi-center international study involving adult patients with chronic kidney disease stage 5 and hyperphosphatemia who were receiving hemodialysis. Eligible patients underwent a 1 to 3 week washout of phosphate binders and then had to have a serum phosphate level of at least 6 milligram per deciliter, but not higher than 10 milligram per deciliter, and show an increase of at least 1.5 milligram per deciliter from screening. Patients were then randomized to one of 6 tenapanor doses, 3 or 30 milligrams once daily, or 1, 3, 10, or 30 milligrams twice daily, or placebo for 4 weeks. Patients took 1 tablet in the morning and 1 in the evening just before breakfast and dinner, respectively. Key exclusion criteria were inflammatory bowel disease, gastrointestinal bleeding, or other GI disease, serum parathyroid hormone levels exceeding 1,200 picograms per ml, severe metabolic acidosis defined by a bicarbonate concentration less than 18 millimole per liter at the last visit before randomization, and clinical signs of hypovolemia at randomization. At the end of the treatment period, patients resumed their pre-study dose of phosphate binders and underwent a follow-up visit 1 to 2 weeks after the last dose of study drug. So what were the key findings? Well, 162 patients were randomized, of whom 115 received study treatment. Patients' age were 59.1 years, and 64% of the patients were men. Adherence to treatment assessed by pill count was generally high, ranging from 85 to 96%. 58% of patients experienced at least one adverse event during the study. The incidence of adverse events was similar to placebo at 42%, and tenapanor at 1 milligram twice daily, 43%, but was higher with other doses of tenapanor, 57% to 76%. GI-related adverse events were the most common ones encountered during the study, reported by 23 to 76% of patients. Of these, diarrhea was the most common adverse event and was most frequent at the highest doses. 9% of patients had at least one serious adverse event, but none of these were considered treatment-related. The proportion of patients achieving a more stringent serum phosphate level, defined as less than 4.5 milligram per deciliter in a post-hoc analysis, was 5% to 23% with tenapanor. The proportion of patients who reached the predefined serum phosphate goal, which was less than 5.5 milligram per deciliter at the end of the treatment early termination visit, was numerically higher with tenapanor, 9% compared to 43%, than with placebo at 8%. Pharmacodynamic effects of tenapanor included serum phosphate lowering, increased stool frequency, and softening stool consistency, which in fact might be beneficial to a substantial proportion of the patients on dialysis. It will be important to investigate any potential drug-drug interactions with this tenapanor in future studies. So what are my thoughts about this study? Well, this new drug does provide an interesting approach to limit phosphate absorption from the gut. But indeed, as encountered in the study, diarrhea was problematic. Nevertheless, this could be used as an adjunct to existing therapy, particularly in those who might have some constipation. At the current time, I don't think the study will change current patient management, but it does introduce a novel therapy to control the serum phosphorus, and it will be interesting to see what future studies show in this regard. Once again, it highlights the idea that we need more effective phosphate binders, and this is at least a study in that right direction.